I'm Rick Buck, and I've been a dentist for 16 years. Today we're going to talk about what dental crowns are and why you might need one. A dental crown is a prosthetic device that is cemented onto a damaged or decayed tooth to improve its strength, shape, and appearance. It is often referred to as a cap since it covers the entire tooth from the chewing surface down to the gum line. However, unlike a cap for your head, you can't just put a crown over your whole tooth without modifying it. If you tried to do that, when you bit down, you would only bite on that tooth due to the added thickness the crown provides. So to make space for the crown, we have to file it down at least 1.5 millimeters from the biting surface and all the way around the circumference of the tooth. This negative space will be filled by a crown that is fabricated by a lab or sometimes by the dentist, and it will replace that negative space that you drilled away. The typical process of getting a dental crown involves 2 appointments for, I'd say, most dentists. During the first appointment, your dentist will prepare the tooth by removing any decayed or damaged parts and shaping the stump, for lack of a better word, so that it will fit a crown optimally. Then a dentist will take an impression of your tooth and send it to a dental laboratory where the crown will be made. At your second appointment, your dentist will slide the crown onto your tooth and make sure it fits properly. If you and the dentist feel like the crown fits properly and looks nice, the crown will be cemented into place, leaving you with a strong, healthy, natural-looking tooth. Some dentists will do this whole making of the crown in-house and will do this all in one long appointment. The crown can be made of many different materials like gold, zirconia, or even a combination of materials. So why might you need a dental crown? The main reason is to prevent your tooth from breaking. And here are a few reasons why your tooth might be vulnerable to breaking. 1. Cavities. Suppose your tooth has significant decay that undermines the tooth to the point that a filling would still leave the tooth susceptible to fractures. In this case, a crown is used instead of a filling to prevent the tooth from breaking in the future. And we know about how much tooth you need before a filling just will not support the strength of your biting down on it. 2. Root canals. Look at this tooth here. Can you see how it is fractured? You can see I had done a root canal on this tooth about 6 months prior to what you're seeing right here. And they were supposed to have a crown done on it. If your tooth has a root canal, it is vulnerable to breaking. This is because a root canal leaves the tooth brittle and it gets more brittle in time. And then once you've done the root canal, it doesn't have a core to give it strength. And without the enamel's underlying core, it is just susceptible to breaking and fractures. In fact, this study shows most back teeth without a crown break about 1 to 5 years after a root canal. Front teeth may also need a crown after a root canal, depending on how much tooth structure was removed. Quickly, before I get into the most interesting part, I developed the best toothbrush, floss, and other dental products that are in Amazon affiliate links in the description. And these dental products are more advanced and will give you a stunningly clean mouth. You should watch my videos about why they are the best posted at the end of this video so you brush and floss with superior results that avoid gum disease, cavities, and give you fresh breath. 3. Cracked teeth. Not every fractured tooth needs a crown. A few of the more pronounced or painful tooth fractures can be secured to prevent the deepening of the fracture if a crown is done and holds it together. 4. Fractured teeth. If a crack in the tooth progresses before having a crown done, a piece of the tooth may fracture off. A crown can be used to prevent the weakened tooth from more fractures, and it can be used to restore the proper dimensions of the tooth from having the tooth fracture. Now, there are also reasons for crowns that don't have anything to do with possible fractures at all. Those reasons are as follows. 5. Cosmetics. Look at these front 5 teeth that we worked on here. In cases like this, teeth that are misshapen, discolored, or have cosmetic imperfections can be covered with a crown to improve their appearance. And it just doesn't improve your appearance, they can give you a Hollywood smile. In fact, people in Hollywood have teeth underlying that look like these did before we put crowns on them. 6. Improve sensitivity. Sometimes a tooth will become sensitive because the underlying level of the tooth, called dentin, is exposed. Exposed dentin can be very painful for some people, and a crown will cover the exposed dentin to eliminate or minimize the pain. 7. Implants. To replace missing teeth, a person can have an implant or artificial root placed in the jaw. A crown can be screwed into the implant to replace the missing tooth. 8. Bridges. Another way to replace a missing tooth is to connect 3 crowns together. 2 or more of those teeth will be on what we call abutments that are filed down teeth, and they are cemented into place just like a crown. And they will attach to a crown in between the teeth that replaces the missing tooth. So really these are bridges, but they are pretty much just 3 crowns on top of 2 teeth. 9. Replace metal. If a patient wants to replace metal fillings in their mouth, a crown is one way you can replace them. And sometimes metal fillings will leave a stain behind, and you can't really do a filling to replace it because the tooth is now stained that metallic color or hue. And so a crown will completely replace them and restore the cosmetics. 10. Stopping wear. Sometimes the conditions in a person's mouth are such that their teeth wear down easily. Take these teeth, for example. Crowns can be used to prevent the further wearing down of teeth. What's funny is you have to wear them down even more so you can stop the wearing down. But I digress. 11. Restoring the vertical dimension of the jaw and face. If teeth have gone through substantial wear, the vertical length and dimension of the face and jaw will collapse over time. With crowns on multiple teeth, you can build up the teeth and build back and restore the natural position of the face and jaw to a state that it was before the teeth were worn down. 12. Change the position of the jaw. For some people, their teeth position forces their jaw to close in a way that stresses and hurts the jaw joint and the muscles that hold it into place. Crowns can possibly be done to many teeth so that the teeth bite in a position that doesn't stress the jaw joint and muscles. Now, if you want to know more about the details of how the crown procedure is performed, watch my video on all the appointments and the full denture procedure for a crown. Watch all my daily tooth care videos I have posted now for the best technique, tips, and products for a stunningly clean mouth that avoids tooth decay and gum disease and gives you fresh breath and white teeth. My dental products are in Amazon affiliate links in the description below this video. If in Southern California, my dental office is in the description as well. Like and subscribe to my channel if you have teeth.